Colorado has a list of healthcare workers that they can call into duty if the pandemic gets out of control. 6,000 Coloradans, willing and able. Not one has received the call. I mean, you had hospitalizations jumping again today, near a record and rising, and we're down to under 100 available ICU beds. We know how stressed healthcare professionals are. Our Steve Steger asked the state why it's not calling on the reserves.
I went to New York for a month in April of 2020, right when the pandemic started.
Dr. Camilla Sassen's been in the thick of the pandemic since the beginning. She's been in the Dakotas, Texas, California too, helping out hospitals in states seeing massive surges in cases. Every time she deploys, she finds healthcare staff feeling the same way.
That sense of feeling overwhelmed, feeling like there's no end in sight, and then feeling like even though you're doing your best, it may not be enough. We have to send in that relief pitcher to just give you a break for a minute and give you a breather.
With Colorado's hospitals starting to hit that level, Sassen assumed she'd get a call.
Right when COVID started, there was a volunteer list where you could volunteer as a healthcare worker, whether you're a social worker, a physical therapist, a nurse, a doctor. And so a lot of us put our names on the list saying, look, whatever you need, put us in.
But Sassen says she hasn't gotten a call. Neither have the doctors she knows who signed up for that same list. The state health department says more than 6,000 people signed up as part of its disaster volunteer program. They've used about 3,000 of them at vaccine clinics across the state since February. But as staffing shortages plague hospitals, a spokeswoman for the health department told me they're still working out a plan to figure out how to connect volunteers who have signed up with facilities that can use them.
I'm hearing about FEMA coming in. I'm hearing about all these other things happening, but what can I do personally to help?
Sassen, who's an ER doc, says she and her colleagues who volunteered are ready to do whatever they're needed to do.
I have been in situations where literally I have, wheeled people to radiology. I have helped change their bed sheets. I have done whatever it takes to get that patient cared for. Tell me where you want me to be tomorrow morning. I'll do it.
State told me today that they are using these FEMA teams because they're federally funded, part of a grant, and they have an operations center ready to send people to fill gaps in hospitals with staffing shortages. They're using contracted healthcare workers there because they know that those workers will be able to do a 2-week shift rather than just work a day or two or even a few hours like a volunteer might in that case. But Dr. Sassen in this case is just saying it's surprising to her that there are a lot of people she knows who've signed up for this list, haven't gotten a call yet. We do know of one volunteer from that list who's being used in the staffing center. That's kind of the operations center for the state where they're trying to figure out where the shortages are. And they're working on a process to try to connect volunteers with hospitals that might need them.
So this list came about when we were in that real panic point early in the pandemic where it was how do we find people who know anything about medicine and get them in there? I mean, they were asking for retired doctors and nurses and folks like that. I can imagine if I'm a hospital that's at a crunch point and I have a choice between a FEMA team that's trained, ready to go, knows what they're doing with COVID, and, God bless them, some doctor who retired 20 years ago, I want the FEMA team.
Absolutely. Also, the FEMA team is already paid for. It's part of a federal grant that's out there. Same thing with the workers that the state is offering to provide through this fusion center that they have. Those are workers that they've paid to be ready to fill in and be ready to be there for a long period of time and be ready to do the work that needs to be done.
All right, Steve, thank you.